See you guys. All right, and YouTube is doing its slow ass thing. Okay, so we are live on Instagram, YouTube, and Facebook. So hopefully this message gets spread. The Facebook one will not be shareable, so you'll have to use the Instagram or the YouTube link, which I believe the analytics on the YouTube video this morning when I woke up or went to bed, it was like at 200 views. It's climbing at like 100 views an hour. So we're up to 3367, which is the highest YouTube video I've got. Even the rant one that got shared. So I want to address some of the ridiculous comments that are being left on this. I've deleted some of them because it's just a troll, but I'm going to address some of them because being called a racist is absolutely ridiculous. I hid most of it. I'm trying to find the actual comment here. Black woman speaks her mind, a random white woman, angry. I'm pretty sure in that video, I was pretty calm. And that was actually after I left Luana's live video and left facts that she's lying. All of my friends are Black. Actually, one of my best friends calls me a strong Black woman. I grew up in Detroit. I might be white, but I can go from Harvard to Hood in 0.2 seconds flat, folks. But I have mixed relatives. My stepmother was Black. She took care of my grandfather for 26 years until he passed away. And all of my best friends are Black. So that's inappropriate. That doesn't even matter. There's nothing about race in here. I never said she wasn't worthy. What I said was she's having an emotional reaction. And we don't need to see any of that. Calm down and speak with logic and to make it more believable. Hey guys, but I follow Be the Change out of Dallas, and my followers on Facebook also have gotten involved with them and also follow them. They stand for be the change that you want to see happen. Do something. Quit being an internet troll and do something. You don't need to sit. Nobody made you watch my video. Some of you didn't even watch it and left stupid comments, and the answers are right in the video. But don't be bothered. You know, it's easier to just troll somebody on the internet. Leave it up to white people to discredit POC, and I'm just like, why does race have to play into this? At what point in time did I ever say she's Black? She's not worthy. I never did. Race. They were calling me a racist for bringing up the fact, and it's facts. I've shared the link. I've shared it all. Hispanics and Blacks are more prone to the complications of COVID due to their comorbidities. I mean, it's a fact. It's science. You're going to argue science and call me a racist. Whatever. Bye, Felicia. But that's absolutely ridiculous because I ruined a business relationship on my last contract to come back to this city to help out because I was ridiculed for leaving. We didn't have any patients when I left, but my counterparts out in New York were having 11 to 18 ventilators apiece, and people were coding every 2 minutes. So why wouldn't I go out there to help? But you know what's happening right now? We are burned the hell out. I had to take a month off. I took my son to Yellowstone to get away from technology and everything and not deal with COVID for a while. The girl I worked with in Laredo, we need help. They're offering like $4,000 a week. She's like, I'm too tired, man. After 6 months straight of chasing this, well, this is what's happening to all of us out here because we are exhausted. And yet we put up with this shit for you. That woman, I'm going to read you the message I got from somebody who was there with her. So I'm not speaking out of my ass, folks. She says, hi, Misty. I saw your response to Luana Rivers' post about University Medical. Thank you for posting that. I am another crucial nurse who was at the same hospital and hotel as Luana. She only stayed 2 weeks. 2 weeks. Yeah, I'm sure she knows all about El Paso, right? Dear, I truly don't believe she is an ICU nurse at all. So she really had no business even being in an ICU if she's staying in an extended care facility. So I was right because I know these people. I know that agency. I know what they sent me. Don't tell me what you think you know when you're not in the hospital with us. She seems like the type that wants her 15 minutes of fame. So she was a drama queen at the hotel and hospital too, folks. As you can tell by the other things she posted, she wants to act like the hero. But did she tell the public who paid for all that new furniture she's showing off? The El Paso community, FEMA, our tax dollars. If anyone wants to be mad, they should really be mad at Crucial staffing. They will stick a warm body with a pulse anywhere. So to the girl below the comments who wanted to argue with me that Crucial doesn't send us school nurses, sorry, sweetheart. This is a Crucial staff member themselves who worked with her, and I believe her over your comments. I believe it was what, Christina? She had commented to Caesar's, and I used to work with Caesar, and he's a great nurse. Awesome. Let's see here. Christina Q. Talking to you, sweetheart. Let me get back up to the one that was finished reading that. They will stick a warm body with a pulse anywhere. I've encountered so many fake it till you make it nurses that it's unreal. They're chasing that money. They come here, they see that a Crucial ad that I put in my video, and it's like when it was in New York, it was $10,000 a week. People are quitting their full-time jobs to go chase crisis pay, and those crises only last a short period of time. And then the regular travelers with regular assignments, the pay is a little bit increased, but not what they're getting paid through Crucial. We come along. And I talk to a lot of recruiters, and even when I have a position with them, I have some that check my contract to make sure I'm getting a fair deal. So I have a relationship with the recruiters. These people expect this pay on every travel assignment, and I'm sorry, you don't get that. It has to take like when you get deployed for a hurricane, that's when we see that kind of money. We've never dealt with a pandemic, so they're throwing money out left and right to unqualified people and putting a warm body to fill a position that's not even qualified. All the nurses we got sent in Laredo, nurses, you know what we had them doing? CNA jobs, wiping butts and cleaning bed sheets and bathing, because you know what? None of them had any ICU experience. My YouTube connection is unstable. Give me a second. It takes at least a week for us to get all of our qualifications done through a regular travel agency. Crucial sends you out in 24 hours. They don't care. They don't check your references. They maybe do a background check, but I guess if your license is valid and there's no stuff against it, they'll take you. I've talked to a lot of Crucial nurses out in Laredo. You know how many left? It wasn't what they were going to deal with. They went somewhere else. They want you to come out within 24 hours and pay you a crap ton to keep your mouth closed. You know what happened to one of my friends down in, I believe it was Houston, when one of the hurricanes hit? They had like 40 respiratory therapists in the hotel. They made her work a 24-hour shift, even though there was relief back at the hotel. She had no idea. She went up to give a report after her 12 and was exhausted and was told she had to stay for 24 more hours. It's absolutely ridiculous. That's what they do. So tell me what kind of agency that is. You're going to burn out the staff and not rotate them and then let them fall out? Another one got COVID. They quarantined her to a hotel room, barely answered the call, made her file for workman's comp. I mean, it's a ridiculous situation. So that's what we're going through. You go ahead and keep attacking us, but we are sacrificing a crap ton to take care of your friends and family members. And this is the crap that we have to deal with. I'm just in shock. Most people are in it for the money, to be 100% honest. They have had several people lie about experience and call any number to get in, because Crucial leaves this particular number that you need to call. Like if you're respiratory or if you're nursing or whatever, you have to call it. But they'll call every number just to get attention and get that money. And they put the ads up on Instagram. Professional, right? How about sending out a text message to registered people that you vetted? Crucial does really shady, unsafe practices that only hurt the community. Thank you for posting your video, because I can tell you the staff at University Medical Center truly do care about the community. We do. I loved my job there. I loved my job at Las Palmas. Every place that I have dealt with, the Providence hospitals, even though I haven't worked there, I got care there. Got treated great. I had no complaints. Many of our therapists and nurses work multiple jobs because we are understaffed normally in El Paso. At Las Palmas, we normally had 5 open positions to fill. And then you have all the other hospitals that need help. There's not enough of us here, folks. And then I get told that, let's see here, that like I want attention, and there was always ridiculous negative comments. I'm going to tell you what, I give of myself more than I take. I make nothing from any of this. I was a private person. My rant video I did for my friends and family, and they shared it in their Michigan Facebook groups when it was going to hell in Michigan, and it went absolutely crazy. I had to open it up to public comments, and I dealt with worse crap than this. But I'm a strong person. I deal with PTSD advocacy. I was emotionally and mentally abused by my ex-husband. So I do speak up, and I speak up when it's wrong, and this is wrong. I'm sorry. I give of myself more than I take from anybody. And the one thing that every supervisor, when I do my reviews, says is, you are passionate about your job and you love your patients. And I do treat my patients like they're members of my family. I have family members thanking me all the time. I have people remembering my voice and me talking to them when they come up off a ventilator out of sedation. You don't know the care I give. This woman was here for 2 weeks and she does not know this community. And I'll be damned if I'm going to let somebody trash our community, knowing damn well that I work with these people and those doctors and they do care. Let me give you a little bit of information. The doctors are doing consultations by Zoom. They rely on respiratory on those ventilator patients and the nurse to give them critical information in order to make changes to the patient's care, which normally they do. They only come to bedside in the hospital if we're having a problem and we need them. If not, we give them our case, we explain what needs to be done, and they give us the go-ahead. So that's normal across the country, folks. It is. In Laredo, they hadn't seen a single patient in person until they are COVID-free, and then they make it up to the COVID floor. That's not abnormal. That's not avoiding going into your patient's room. That is not avoiding care. It's mitigating the risk to the staff. If it's unnecessary and you don't need to be there, you don't need to be there. When we have a code blue and there's 40 people in the room, guess what? Get out, wait in the hall. When we need changes for people doing compressions, we'll call you. But we don't need all this congestion in the room because we have look-ins. That being said, again, only 10% of people survive in hospital CPR. So us not doing CPR is really not a big deal. We have, at this point, COVID destroys the lungs, the heart, the kidneys. It shuts a lot of things down. The brain, people are getting encephalopathy. When they were coming off the ventilator and they were off sedation for 7 to 8 days and they were still acting confused, it's because of the brain. The brain is inflamed. And then they've had, the long haulers are having brain fog for months. They're wondering if it's ever going to clear up. These are the effects of COVID. It's what happens. Unfortunately, there is nothing that I, a doctor, a nurse, or anybody can do aggressively. She gave no example in her post as to what we could do aggressively. Her only thing was we weren't doing CPR. Well, sweetheart, we aren't doing it in many hospitals across the country. We'll use medication, but at that point in time, we have done everything humanly possible with medications, machines, everything to keep you alive. CPR is not going to save you. It's going to put all of us at risk. You want to know what I wear? You'll see it on the news tonight because, right now, KTSM is going to be airing a short clip of our interview, and at 10 p.m., our full interview will be aired, and there will be a better story than what Lawana's was because education is important. But this is the mask that I wear. 12 hours, if I'm lucky. I don't bitch because it's safety for me and I can take care of your family members. What happens in these cities that get hard hit all of a sudden, like in Laredo, where 100 staff members were infected, yes, they get scared. They don't want to go in the room. And let me tell you something. They're not getting the pay that Lawana was getting. They're not getting the travel pay that I'm getting to go in there. So you know what? If they don't want to work COVID, That's okay with me because I'm getting paid more money and they're not getting paid crisis pay. As a matter of fact, some of these people have had pay cuts during the pandemic, and look how they're working. So don't you dare insult my friends and my coworkers. That is your neighbor. That is your loved one that works in that hospital. We all represent the hospital as a whole and as a team. And how dare you? How dare you? You should be ashamed of yourselves. You can just leave all the comments you want because any hate and racist comments is coming off. You're blocked. This is not what this community is about. Trolls, I don't have time for them. Ask my regular followers how I handle them because they'll be more than happy to comment to you on how I handle this crap. But education is a passion of mine. I educate. It takes me a long time to do my rounds when the family is there because I educate. I go back to my patients' rooms. You know what I don't do? I don't sit down and take my lunch break. You know where I'm at? I'm in the patient's room that need the most attention because that's who I am. And that's the kind of care I give. I give just like I would to any family member. So don't you insult me or any of my coworkers who do that same thing. Yes, there is crappy people in every profession, okay? There are. Unfortunately, it's what happens. People can be crappy human beings. Look at the comments on that YouTube video. It's unbelievable. But I didn't do my original rant video to get attention. This girl has no information other than, oh my God, they're killing people. But no answers as to what we're supposed to do besides coding people that we're not doing across the country. She was in a nursing home, an extended care facility. Those were locked down in New York to any positive patients so they didn't infect. And they had to force the governor of Michigan and New York to allow COVID positive patients into those homes. So please tell me how much she really dealt with. No, but I'm sure she's really enjoying that new furniture that FEMA paid for, our tax dollars, for her to come out and do this. Not credible. My followers went over there to ask her the same questions that they asked me, and my Facebook is going crazy right now with stuff because that's who my peoples are. Hey guys. Yeah, technology. My hubby's sister has been exposed to COVID now. She said she had, yeah, I have forget. One of the guys I met up in Illinois while I was up there, he was coughing at work, like allergies, and nose was draining. And guess what? He had to go get tested for COVID and was off work until it came back. However, some of the hospitals are making us stay with symptoms if we develop them at work. When I had back surgery on September 11th. I wanted it done before cold and flu season, so I was a whole person to come out here and help on the front lines and not have to slack off and have somebody else do my damn work. 13 days, I went back to my doctor and skipping, and he couldn't believe the fact that I was even walking without a walker or anything else. So I went back to work to get my butt back out on those front lines. I sacrifice a lot of my time, my energy to provide this education, and this is the crap that I get. I'm not looking for attention. I'm not up here crying and boo-hooing that we're killing people. No, we're not. Unfortunately, when we have a mass amount of people who come down with the virus all at the same time, like I said, it's 2 to 3 weeks on a ventilator. We're up to 201 vents today. We've increased. Thank God we have 428 in the community. But when we have a mass amount of people who get sick at one time and they are prolonged on those ventilators, that's why we run out of hospital rooms. Normally a patient is like 5 to 7 days. We try to get them off immediately because the longer you are on the vent, the more complications we have with you. And that's another thing that people do not understand. You want to ridicule me, but you don't understand the disease process and how my machines work. And instead of throwing nasty comments at me, ask a question. A respectable question. That's all you have to do. I'm out here to answer questions and help people understand and not have fear. I get private messages left and right, morning, noon, and night, and I stop whatever I'm doing whenever I can to answer those questions immediately because people are scared, and I am trying to mitigate that. But she's doing this for attention. Other people have gone over and watched her videos and cannot believe the crap that she's saying. And another thing, the woman said she doesn't believe in masking and that it doesn't work. But yet you look at her damn picture And she's wearing an N95 and telling people that she has to sleep in it. Well, sweetheart, if masks don't work, why are you wearing one? Seems like a little hypocrisy to me. Think about that. Look at the example she's setting. Why don't you go over there and troll her and ask her those questions? Because those are important ones. We sacrifice a lot. All these people who are working their butts off, they're not seeing their kids. They're not seeing their family, because a lot of them aren't even staying in the house just to reduce the risk of giving it to their family. RVs for MDs was they created a Facebook group and a resource for us to be able to go and stay somewhere so we didn't have to worry about bringing this into our families. So a lot of us are going without seeing our families for weeks, months, depending on how long this lasts. Have you heard of her? You know, Joel just asked a good question. I need to look more into that because I did see something briefly about it. I was looking for some updates from my normal sources and I didn't see it. I am going to make a note of that and I will definitely address that in another video, but I need to do research. When I do research, I go to things like the New England Journal of Medicine, things that are peer reviewed. I don't go pull things off the Washington Post and the New York Times because that's not credible sources. That's full of bias. I deliver to you the source so that way you can go look at it and make an educated and informed choice for you and your family. But that's a good question. I did hear something. I don't know too much about it. What I did want to talk about is the Pfizer vaccine. I did do some research on that. MedCram.com, they're on YouTube. You can follow them. I've done it. I dare you to go look at their modules. There's like 115 of them, plus the like all the different testing. No problem, sweetie. But he is a pulmonologist out in Palo Alto, California, and he takes his time to do the exact same thing I'm doing. And that's where I get the majority of my information from. So people telling me I'm not credible, who made me Dr. COVID, I'm a respiratory therapist. That freaking ventilator is my job, and this is well within my scope of practice. I would not have been interviewed by multiple magazines, a medical health magazine. The news just came to the house today and did a long interview with me if I wasn't credible and knowledgeable about what I'm talking about. I've had doctors contact me. Another one followed me on Twitter today. So I do know what I'm talking about. If people who are above me are coming to me for information because they know I'm well read. All I do is research. I don't sit and watch TV. I quit watching the media 4 years ago during the last election. I don't play that game. I go to the source and I find my info. And then I give it to you and I share with you where that came from. And so does the doctor on MedCram. Everything he talks about in his videos is linked right in the bottom of the YouTube description. And he's great. But what happens is, like, the nurse who worked with Luana State, I'm not going to mention her name. She didn't say it was okay to do that. But they do chase the money, not the patients. I could have made more. I could have went to Dallas for $4,000 a week, but I wanted to be home in my community. And it is my community. I live here. Somebody, oh, you say it's my community. It's our city. It's all of our city. We should all be working together as a team, just like we should be working together in America instead of divided red and blue. I stand right in the middle. I might be conservative, but when it comes to this virus, I have very democratic views because I do believe in masking. Let me explain the mask. We know that the exposure, the level of the exposure of the virus. So if you are around a super spreader who has a very high viral load, you are going to have worse symptoms. If you wear the mask and you still get exposed and the other person's wearing a mask, you're going to have a minimal exposure. Well, you know what happens? We have minimal symptoms. So that mask is very important. A lot of our opinions about masking have changed, even Zdogg. And that's where my video cut out. I'm sorry I ran it through the encoder twice. It took 4 hours and it still skipped a few spots. But Zdogg MD, he has a lot of great guests on his show that talk about the science behind things and the fears. And I really recommend that you follow him. A lot of my followers have gone over there and become supporters and has tried because we get the private videos. But don't ever mistake my passion for anger. I might type in all caps and I might type very firm response words, but I do these videos so you can see my face. I'm not an irrational nurse who's crying and telling everybody that we're killing people. She's not doing anything to help the situation. Has she given you any information on how to stay safe or answered any of your questions? No. My followers went over there and asked her about, what do you know about RLF 100? Crickets, because she don't know. RLF 100 is a drug that Houston Methodist is trialing, and now there's 3 other hospitals that are also doing it. The results should be out in January, but they are showing a 9-fold increase in survivability in our critical care patients. Currently, nothing works for our critical patients. Nothing. And that is why we can't be aggressive. There's nothing we can do. That pisses me off. She has no idea. And that's how I know she's not a critical care nurse. I guarantee you she doesn't specialize in it. Your RT bot RN. What the hell is this? I mean, people are just getting freaking ridiculous anymore. Let's see what this comment is. Your RT bot RN. You're speaking of respiratory system. We're talking about human decency to care. We're allowed as humans to have emotion. You have no emotion. Oh, I have plenty of emotion, sweetheart. Ask my ex-husband. I mean, this is just ridiculous. RTs and RNs work closely together in the ICU. We rely on each other. We really do. When I'm not in the room, the RN has my back. And when I'm in the room with the patient and I see something, I have my RN's back. So don't tell me what you know, Annabelle Lee, because you don't. We all have compassion for care. There's a great video by the Cleveland Clinic that we all have to watch in a lot of orientations on empathy. You never know what other people are going through. But you don't have an emotional reaction like that and act like everybody in that hospital is a piece of crap and that we're not doing our jobs. That's not true. And she can't even give you an example other than that we're not doing CPR, which is standard. It's been standard. I took a picture when I left of UMC's policy for COVID because we just instituted what we were going to do and prepare for. So Annabelle, bye, Felicia. You don't know. And by the way, Annabelle, I specialize in critical care. I do have a bachelor's degree, just like most RNs do, because most of them are made to go back and get their bachelor's degree, and mine is a critical care focus. So please tell me again what I don't know. This is what pisses me off about people. They make assumptions and they make asses out of themselves by leaving comments like this. And she couldn't even finish the comment. Because it hasn't affected your family yet. Oh, you know what? It very much has. It very much has. See, you don't know. You really don't know. I just love how you make assumptions about things, sweetheart. And when it does, I hope you have the same response. You know, that's funny because I've held the hands of many dying patients because their family couldn't be there. I guess that's not compassion, is it? Guys, is that compassion? Yeah, I'm pretty sure it is. When everybody else is afraid to go in the room and I'm the one going in there to hold hands? Yeah. Okay. Why can't a doctor go in rooms? I told you, Annabelle, to mitigate the risk to the patients. Scott Weingart, he is the doctor who does MCRIT, and there's another doctor who does PalmCRIT. They are the ones who started pretty much the COVID procedures that we follow because they had the hardest hit. You know, Annabelle, he does it by himself. He doesn't even allow anybody else in the room. There's somebody standing outside the room giving him step-by-step instructions. So instead of coming on here and attacking my character and somebody you don't even know, why don't you just ask a simple question? This is ridiculous. You are having the emotional reaction, Annabelle. It's in your words. It's in your statement. You can't even ask a question without, insinuating things and calling people names, and that's all we're reacting off of emotion. They don't want to get that's the hospital policy, Annabelle. It is a team. They rely on their team. We work together as a team. We specialize in critical care because we communicate with the doctors, and it is policy. I don't care if you don't like it. You want to do it? You come to the hospital and you get your ass in our shoes and start PPE and our equipment, and you go do it. And then you come back and tell me what you think. The only person's opinion I give a shit about is the ones that's working on the front lines. Like Cesar, and he busted he's a freaking awesome nurse. He knows what he's doing. So when you can put yourself in his shoes or my shoes, you come back to my page and then you come tell me what you think, sweetheart. Same for nurses. They want to make money, but sit while people's blood pressure are dropping dangerously low. I believe in karma. Well, let's talk about the Bhagavad Gita. Are you familiar with the Bhagavad Gita, Annabelle? I bet you're not, because you know what? You do all things with love, and you won't have to worry about the universe coming back to bite you in the butt, because all you have to do is think those negative thoughts that you just put on my page, and the universe will make it right with you. So let's talk about karma, sweetie. I'm very well educated because I don't watch TV, I read. And it's very obvious that you do not. And it's obvious that you don't know frontline workers. The doctor, it's not his choice not to go in the room. It's hospital policy. You got a problem with that? You talk to administration, because they're the ones who make the rules. Unbelievable. We go in there if it's necessary. There was another comment about us not going in to do x-rays. You know it takes about 4 to 6 weeks for a COVID x-ray to change? Do you know how much radiation a patient is exposed to every time we do a chest x-ray? If there's no change in a patient, there is no reason to go drawing blood gases. There is no reason to expose them to unnecessary radiation and things like that. So while you think you know what we should be doing, we have to look at a whole clinical picture. Is the patient even stable enough to transfer to the CT scanner, or are we going to cause them more damage? Is it going to change the course of treatment? That's what we look at. If it's not going to change the course of our treatment, then we are not to do it. Those are the rules, and I don't care if you like them. We have to follow them. She doesn't take this crap lightly. It's an easy block. Oh, yeah. You will find yourself off my page. I am here for everybody, but I have people coming to me of all ages. I'm doing this on 3 platforms because when my rant went viral, I had a lot of people contacting me to please upload these videos to YouTube, which I finally got to do all of them yesterday, and there's 70. So obviously, yeah, I have a few emotional ones. Annabelle, why don't you go back to like April when there was a bad start to my week, and you look at emotion there, sweetie. I mean, karma, it's going to come back and get you for that statement. Instead of assuming, maybe you should just ask a question, because we're here to answer them. But when you come at us with accusations like that, there's a feedback loop when it comes to communication, and there's like 8 steps that have to be followed. And if you start acting like that, it's just like you yelling at your boyfriend or girlfriend or spouse. What's the first thing they do? They quit listening to you. Just like Luana, people just quit listening because she's so emotional that she's not providing any benefit other than inciting more fear in our community. And that's not what we're about here. Sorry. But by like 4 days. Well, when the final results of the large study came out, guess what? Nothing changed. You know what else didn't change? Convalescent plasma. And I had a doctor call me last week, and we had a long conversation, and I did tell him I noticed that up in New Jersey, my patient's blood was extremely thick, extremely, even while on blood thinners. So, Luana, once again, you want to bring up blood thinners? I was up in the New Jersey area. We had every patient on blood thinners, and you know what? I couldn't get a blood gas on damn near every single patient, and they weren't using art lines either. So, come to find out, when I did more research, funny because my fortune cookie said I was going to get an answer to a question I'd been asking for a long time. Well, I did. Convalescent plasma can add coagulation issues, which is clotting. We are seeing lots of blood clots with these COVID patients. So plasma can actually cause harm. So we're not being aggressive enough. You want to give everybody plasma and cause coagulation issues? Sweetie, you don't have a medical degree. It's easy to come on my page or anybody else's page and make these comments about things that you don't know anything about. Maybe you should just ask and quit being a jerk. Some places are single coverage, meaning that there's only one doctor person. That is correct. That is very correct. And some of them aren't even on site. They cover multiple hospitals, especially in rural areas. We're lucky here. We are very lucky. Folks, what it's going to boil down to with these spikes that are coming up, Utah is going crazy. Their positivity rate is like 24%, and ours in just El Paso is 23%. And their whole state's doing that. How many healthcare workers do you think are going to be able to provide the care that you are demanding from us? I wish we could have you in the hospital because we could really use your support with our patients. I miss you guys. I really do. I love my patients' families. They make my day. I love my elderly patients. I love working with them, and I don't care. Here's another rumor. There was a whistleblower, firefighter. Oh, we're bringing illegal immigrants from the border over to University Medical Center. We have a lot of dual citizens here on the border. They get sick in Mexico. Ask the Mexicans how great their healthcare is. They'll leave you locked up in that hospital until you pay your bill. They send us our dual citizens. They'll be in the hospital. They're completely septic on their deathbed until they transfer them to us. Had they done it 5 days sooner, we could have saved their lives. So if it's a dual citizen, they have every right to receive care in America. The sign on the way to UMC says Hospital of the Americas. If you're an American citizen, guess what? We have no problem treating you. I don't treat my Hispanic patients different. I don't even speak a lick of Spanish. I can understand a few words, but I still manage to bridge that gap with my patients and provide that level of care. Even not being able to speak a lick of Spanish, I have tried. It's too fast. I cannot roll my R's. I make up different words that are definitely not what I should have been saying. So in order to not embarrass myself and completely decimate a language and disrespect it, I don't do that. I'll go get an interpreter. But we have a lot of illegal immigrants that pass over with true oppression. So for everybody in America who thinks they're oppressed, we have people dying and drowning in our sewer pipes and in the Rio Grande to get over here, away from the true oppression that they have. The Border Patrol agents bring them in. I have treated people who fell off our 16-foot fence with traumatic brain injuries, and I don't treat them any different just because they're not an American. They are a human being, and they deserve every amount of compassion and respect as anybody else does. I am not going to change my level of care just because there's a Border Patrol agent sitting outside. So that firefighter was wrong for that. He has no idea who he's transporting. They're not allowed to ask, are you an American citizen or not? They're not. But yeah, he comes out with that. Last year, before Trump changed the rules about where people had to seek asylum, they had to shut down. We have border checkpoints when you get out of El Paso and any large city in Texas. When you're getting away from the border, there's a border checkpoint. They make sure you're an American citizen, that you're not smuggling drugs or children or people. And they all had to shut down over in New Mexico to come help in these areas where we were having an influx. We have like 5 or 6 ports of entry. Somebody might have to correct me. I'm not sure. I drive Uber in my spare time, and I do go to a lot of them. But we have a lot that cross over. They were flooding in through that, okay? The sick children were definitely being brought in for care. When I worked for Las Palmas, I treated a lot of children in the ER for RSV, colds, and flu. Those Border Patrol agents are not neglecting the children or the immigrants. If they need care, they bring them. I treat prisoners. I mean, even the guards in the room with one of the prisoners, they were all really excited about the soccer game last year. They were all getting along and cheering. We all work together as a team here in the community, as a family. And to see these comments, you are the problem. Be the change that you want to see happen. That's not being the change. That's being hateful and spiteful to somebody you don't even know who's out here busting their ass and risking their life to help your community and your family members. Like I said, I ruined a good business relationship to come back here to help. It cost me. I sacrificed something for this. So don't tell me. This is ridiculous. Stepdaughter works at a nursing home and she's sick and they're making her work anyway. She can't take any time off and she said it's just a sinus infection. That's what us frontline workers are dealing with. Non-disclosure agreements. They're not letting nurses talk about getting sick at work. They're cutting their pay. They should be getting more pay right now. They're risking their lives. They are getting sick. Some of them are getting sick and taking it home to their family. And you want it to happen to us? Do you know, Annabelle, we couldn't do dialysis for some of our patients out in New Jersey because the chemicals were back ordered? So we had to sit there and watch a patient who needed dialysis swell up 40 pounds full of fluid because their kidneys are shut down. But you have enough nerve to post something like that and you don't even know. We were back ordered on oral care kits. I was pulling skin off of people's tongues doing oral care because I had nothing to do it with. I was scrounging for anything because if that were me in that bed, I would be livid with my healthcare staff if I had to lay there like that. We were dealing with back orders for circuits for our ventilators, filters, all sorts of equipment. So you don't know. You don't know. You don't know a patient's status whose blood pressure is dropping. If they don't want to be coded and they don't want to be revived, and there's nothing more that we can do, again, what aggressive maneuver would you want me to take? There's nothing you can do. I don't know what about that you people don't understand. There's no more aggression that we can take other than going in there and screaming at the patient, you better wake up. I mean, come on. That girl couldn't give a single example other than we're not bagging people for CPR, which we are not doing across the country because it's not going to save them. But it's going to put every one of us in that room at risk. Is that what you want? More dead healthcare workers so there's nobody left to take care of your family? Should we all just go home and go on strike because we're not getting fair treatment? Is that fair? I mean, everybody else is striking. Why can't we? No, we're sacrificing ourselves to put up with crap like that. And I've heard from many of UMC private messages in my Facebook, on my Instagram, telling me thank you. Thank you very much. There's even a gentleman who works home care who left a comment to my video who said that he treats UMC patients after discharge and 90% of them are happy with their care. So the person who wants me to go and talk about, oh, why don't we ask the patients? Well, he did. So you have that answer, but yet that's not good enough for you. Nothing is ever good enough. We give you answers and it's not good enough. When is it going to be good enough? What is it that you're asking for from us? Because we really need to know, because we're doing everything we can. And I really do, I wish that you could see the work that my counterparts are doing so you could really understand the level of care that we really are providing. I wish we could let you in the hospital. I miss seeing faces without masks in the hallway with smiles and people going home to their family. It is my job to liberate people from a ventilator, not to watch them suffer and die on that damn thing. I used to love my job. I hate that ventilator now. I hate it. It's sad. But the vaccine from Pfizer, it's a different kind of vaccine. From the research, they have two different kinds. It looks like it's a 2-dose vaccine. It looks like the second dose of the first style that they trialed is causing some side effects on the second dose. But another one that they have is like, they're all numbered, is doing better. And they did a study and they stopped the study at a certain point once I think 64 or 74 people contracted COVID. So they could do an analyze, like what they did with remdesivir. They stopped the study at a stop point, analyzed it, found that 90% of people who got the vaccine didn't get COVID. So now we have to, here is, folks, I need you to listen to me about the vaccine, okay? Even though it might protect you, and we're seeing that, what we do not know, and we do not know, is if it will prevent you from spreading it. And that's important, because herd immunity cannot happen without a vaccine. But if you're still able to spread a live virus, then we have a problem. So it sounds great on paper, but there is a but there. So the vaccine is your choice. As I said, I personally am not going to get a vaccine until it's been around. I didn't start getting a flu vaccine until it had been around for about 5 years. I would rather wear a mask. I'm okay with that. In the hospital during cold and flu season, if you don't get your flu shot, you have to wear a mask from October until the end of March. And people do. We don't complain. We know this, but to tell us this is what we signed up for, a pandemic, national shortages, risking our lives? No, that's not what we signed up for. This isn't war. At least our soldiers know that they have some possibility of going to combat. When they sign their paper, it's up to and including their life. It's a blank check. We don't do that. We swear to do no harm and have compassion and care. We have a diversity here. I'm the minority in El Paso. And this girl telling me, I think I got this one open right here. I lived here most of my life, so when you said we, that means there's an outsider stating the criticism. I got in jobs, but never in the city of El Paso. Loving a community does not mean you're blind to its faults. When I was growing up, there was racism against the Hispanic communities. Girl, it is 83% Hispanic here. That's like people living in Detroit saying that they're experiencing racism in their own community from their people. Maybe for having a conservative viewpoint and being called an Uncle Tom, but I'm the minority. The Black people here are minorities. If anybody's going to experience racism, it's us. Now, there's a lot of preconceived notions and assumptions that I had when I moved here, and I was pleasantly surprised when I began to socialize and meet the people of El Paso, and even the Mexican citizens who go back and forth. They are loving and caring. It's this younger generation that your parents aren't proud of, because I've talked to them about it. You have no respect for anything but yourself. You are selfish. Right now, most of the salaried positions go to the people in the family. People with disabilities are able to get jobs, but not in El Paso. El Paso is much harder if you have no jobs. I don't even understand that, because if you open up Indeed, Indeed.com is a great place to go look for work for free. Our hospital systems are begging for employees. If you want a good career, go into the medical, respiratory, nursing. A lot of people aren't becoming doctors. Let me explain that to you. There was another girl, the doctors aren't even seeing us because they have nurse practitioners and physician's assistants to help them out and do that job. They're up there with the more critical patients. They don't have time to come in here for your sniffles. So you do see a physician's assistant. Quit using our emergency rooms as your primary care physician. Call them. The way we're doing things right now is honestly the way Health 3.0 needs to go. We need to start having you call your primary care provider. You don't need to come into the emergency room because you have a runny nose. I mean, that can be handled in an urgent care, but you're taking up somebody else's time and then demanding great care, and to see a doctor who doesn't even need to see you and his physician's assistant can handle it. But those people are becoming PAs and NPs because it's cheaper and it's less risk. Those doctors and that malpractice insurance and all the crap that you guys put them through with your crazy accusations and unreal expectations makes them just not want to be doctors anymore. I know many doctors who have even left practice, went into banking, finance, just to get out of it because administration ties their hands and tells them how they can treat their patients. That's another problem you don't realize. Some of the things we can't do. And I want you to realize that, like, over in other countries, we are the only country that allows you to torture your loved one on a ventilator. Do you know that? In other countries, you're not even given the choice. If there's not a good prognosis, just like a surgery, if you're not a good candidate for surgery, the surgeon won't do it. In other countries, they won't put you on a ventilator. Do you know how much that costs per day? And then it takes more staff with COVID because we have to take the time to put all that PPE on and off each and every patient's rooms. I wound up with hydrophilic eczema and my hands cracked and bleeding and had to come back and go to the dermatologist from excessive hand washing because I wash my hands 100 times per shift. I can't even touch sanitizer because it will cause my hands to break out. That's what we're sacrificing. So there's a lot of things you don't know. And the monoclonal antibodies, those are going to be used for outpatient use. Those will not be there was an article in the news locally that most of you have probably seen. And it shows that the governor is getting this drug out to us. The monoclonal is what Trump was given. What they do is they isolate the one antibody or whichever antibodies are showing the most effectiveness against the virus. The problem is with the regular plasma, it's not improving the clinical outcome. We're looking for an improvement in the PF ratio, which is the oxygen level in your blood divided by the amount of oxygen that we're giving you. But there was no clinical improvement in the plasma patients. The only thing that it improved was the time it took to rid your body of the virus. So it did improve in that case, but in our critical patients, it don't work. So again, Miss Lawana, this aggressive treatment that you want us to give to everybody isn't working. It can cause coagulation issues. So you want us to go kill patients is what you're wanting us to do. You're wanting to give us to give them stuff that's not going to work, could possibly cause complications because you're not happy with the level of care because you don't understand the science behind it. As the girl said, she doesn't even think she's an ICU RN. Thank you, Aubrey. Senior tower next to us has COVID cases. Oh, Michigan they're going under again, man. We're all going under, and there's not enough of us to go around. So please treat your healthcare practitioners nicely. We are out here dying, quite literally, to save lives. That's why most of us are on the front lines. When I get a contract, I don't ask for something ridiculous. I ask for something fair and reasonable for my time, my efforts, and my travel. I'm definitely not asking for $4,000 a week. I'm not asking for $10,000. It's nice to make that kind of money. Hell yeah, it is. But that's not why I'm out here. I came out here because my patients need somebody to care for them. It's sad watching all of this. Our morgue capacity. Okay, we only have so many spots at the hospital to hold bodies. The morgue only has so many places. The funeral homes cannot process the death fast enough. So where do you want us to put the bodies? In the parking lot? Folks, we're trying the best we can. At least they're here. And they're not stacked on top of each other in in the same bin. I mean, because that's the other option. Would you want us treating your loved one that way after they pass? No. I watch many doctors get down on their hands and knees and pray after somebody passes. Trauma doctors, ER doctors, ICU doctors, because that's the integrity that the people have that I work with. So shame on you. Talked about the length of time on vents, talked about the doctors going into the room, talked about the illegals, healthcare practitioners not even wanting to try. I had to write notes because, I mean, this is ridiculous. I really try to provide education, new information that comes out. Like I said, Joel, I'm going to get on the herpes information and I will do just a separate video on that when I find some information. So that way it's short, sweet, and condensed. The RLF 100, the COVID-19 killer. And I got on the media today. I talked to KTSM. I'm like, why are we not talking about this? It's in our own state. It's in Houston. It's a 9-fold increase in survivability. Why are we not talking about this? This is the one drug that we could use on these patients right now. And that study wasn't stopped at its midpoint. to give it to everybody like remdesivir was, but why? I'm going to give you the answer. It's not owned by Big Pharma. There's no financial investment from Big Pharma. Excuse my cats. I'm not sure if they have COVID, but I came home and I had a cat with pneumonia who was very sick. And now I have 2 that are coughing. I don't want to be the person with COVID kitties. I'm afraid to even mention it to the veterinarian. But we're not talking about this. It's owned by NeuroRx and the Relief Therapeutics, which is in, which country is that again? I can't remember. It's over in another country, but they're working with NeuroRx. I believe they're in Pennsylvania. But the people who are running that company are former Johnson & Johnson, I believe Pfizer. There's like 3 different major drug corporations that broke off these head honchos. And they're also working on a PTSD and bipolar depression drug using ketamine. You want to take a look at stock? If any of you invest in stock, start taking a look at that one, because once those results come out at the end of December, January, this stuff's going to soar because they are going public with an IPO, which is going to drive the price up and you guys going to make money. But it is the COVID-19 killer. It's the one drug that we have for critical patients, and we're not even talking about it on CNN, Fox, ABC. You Google it, everything's like in a bio magazine or by the company itself. Nobody's reporting on it because it's not Big Pharma. If you want to be mad at somebody, get mad at Big Pharma. Seriously, because ROF 100 has been around for many, it's a Swiss company, thank you. It's been around for 20 plus years for other purposes. It's a natural peptide that's found in the guts. They make it synthetically. It's been around. We can make this. We can give this. It cleared out Houston Methodist Observation Unit of people on high. We've switched now. That's another thing that's changed with our approach with COVID. We're not intubating everybody anymore. So our survival rate has drastically increased. Drastically. I mean, it's more than cut in half, over half. And we're using a lot of high flow oxygen now because we have happy hypoxemics, which is low oxygen levels. We need to support the oxygen. And these people are coming in functioning, breathing quickly, talking to you, telling you that they feel fine, but their oxygen level, normal patients would be as blue as my headband. Lips blue, everything. There's the fat 25-pound COVID kitty. Hi, Worf. Worf's famous. Everybody loves Worf. But we need this drug. And I would urge you to put pressure on your local news going, why are we not talking about this? What about this drug? This could help people. This could really solve a lot of our staff shortages because they wouldn't need us in every facility that's busting out. Like I said, in Laredo, we had to put people in the Red Roof Inn. That's how bad it got. That's how bad it got. Oh, palliative care. Thank you. Another thing that's not really, we don't have palliative care here. Palliative care deals with like chronic pain and comfort. In a lot of the other hospitals, I haven't worked in too many on the other side, like in Dallas and Houston and those larger areas, but I know Laredo didn't have one because I asked, do you have a palliative care team? Because we have cancer patients who are suffering. They don't want to give them any more pain meds because they're afraid we're going to kill them. And they're sitting there in pain and suffering. But palliative care is a specialized team of doctors, nurses, and whatever that go to each patient and assess them for appropriate therapies, and they give them what they need and they monitor that. We don't have that here. Another thing that's not looked upon highly is hospice, because in the culture here, they want to do everything. They need to feel that they have done everything that they possibly can for their loved one. And sometimes, guys, all that we do is causing more damage and pain and suffering. If you had to watch somebody's chest turn to mush from repeated compressions, every 30 minutes for 12 hours, there's nothing left there. How would that feel to you? I need you to think about that, because a lot of things that we do cause more suffering. I know it seems like you think that you need us, but it's not going to help. in a lot of cases. And we try to talk to you about that. And hospice is not a bad word. Hospice is not about death. Hospice is about enjoying and having a good quality of life until you pass. It's not about you're going home to die. And there's a lot of misinformation about hospice out there, and we don't do a lot of hospice here. Now, up in Illinois, we had a lot of comfort care patients. They didn't want to go on the ventilator, comfort measures only, which means we support you, we give you meds for pain, and we quit torturing you. That's why it's called comfort care. So we really need to change how we look at hospice care, because hospice care is actually, hospice was a beautiful thing to work. It was, I learned so much from people dying. And you know what? They're at peace with it. When you are with somebody who's getting ready to pass, it's a look of peace. It's really strange. You would think it'd be agony. And now in traumas, yeah, I mean, everybody who dies in a traumatic way did not go out in a good way. But those who have a terminal illness have had time to understand the disease process. They're very accepting and they're very at peace. And I'm very blessed to be able to sit with these people and learn from them, because I go to my next patient and I help them understand what things are about and talk about somebody else's experiences. So for you to sit there and tell me I don't have any compassion, talk to my supervisors. I have too much of it. It causes me to be a little bit behind on my work sometimes, because that's how much time I give to my people. 15 minutes per patient. Girl, I do 20-minute ventilator checks because it's thorough. My people at Hurley Medical Center in Flint, Michigan, they're almost at capacity, but it's not with COVID patients, thank God, at this point in time. But I learned a lot there. It was homicide capital for 2 years in a row when I worked there. The stuff I have seen, I can't unsee. It's trauma. It's a lot of trauma. And thank God I don't see that here. It's another thing. El Paso is one of the safest cities in America. My cousin was going to come down here and work, but they canceled her contract. But she was scared to death to come here. So was I, thinking everything that was going on in Juarez happens here. No, we don't get that. We get a lot of drunk driving. Alcohol is the drug of choice here. People love to drink, and they get behind the wheel of a car and cause a lot of damage. We have a group called 915 Can't Drive. And oh my God, the stuff I've shared it on my Facebook page. You guys see it. We can't drive here, especially when it rains. But some of the best people you'll ever friggin' meet. They'll give you the shirt off their back. Let's see here. I'm looking at all the comments, guys. Sorry, let's talk about forcing nursing staff back to work that are still showing symptoms. Yes, that's not okay. If you're testing negative and you feel good to go to work, but I know a lot of people, my landlord got COVID. This poor woman looked like a zombie. She was taking care of my cats and she feels bad because she thinks she might have got them sick. But I took one look at her pictures and her mother had just before I left to go to Illinois, I found out her mom was on a vent with COVID. And thank God they had called them to talk about what she wants to do because they didn't think that she was going to make it. And thank God this woman pulled through and she fought, because that was my landlord's support. And my landlord is a beautiful human being, very compassionate, very caring. This woman looked as white as me with deep black eyes. She could barely talk. I hear her coming to take her trash out because she's coughing and I can hear her trying to breathe. And I'm like, don't do that. She goes, doctor said I need to be moving around. So it does affect us. If you're not symptomatic and you're feeling good and your test is negative, great. But being forced to go back to work when you feel like death and look like death, that's when mistakes happen. Unfortunately, we make a lot of mistakes in healthcare because we are human. And when we are tested to our limits and we don't have the staff to provide the care, that's when mistakes happen. So to force people back to work who have brain fog and are not ready to go back to work is causing a detriment to medical care. It's not an asset. Having a warm body there isn't going to do any bit of good if it could cause somebody else harm. What I asked on my news broadcast, and you'll see it at 10 o'clock on KTSM, was for our health administrators to listen to us. If we tell you that we need something, if we tell you that something is wrong, listen to us instead of punishing us for speaking up. Non-disclosure agreements are not a good thing. Shaming us and making us feel bad for speaking up about it's OSHA. It's an occupational safety hazard to not have the equipment to do our job, but some of you are some spoiled ass people. These little comments on one of these news broadcasts about, oh, we have to use the same mask for 12 hours. Folks, I had to use the same mask until I couldn't hold the straps on with staples anymore. They were giving me the Chinese KN95 mask, and that is when I left my contract in New Jersey, because that is not an N95 and that is not safe, and that's what they were offering us. So for those of you who have 12-hour masks and you get to get a new one the next time, that's great, because we were spraying ours with TB virucidal and hanging it up. That's what we were doing. I still do it just because I don't know if I'm going to have the equipment that I need. My awesome followers sent me N95s that they had when I was out in New Jersey so I could stay safe. And I have good people following me. I have some dedicated followers. When I had my back surgery, I used to only be able to sleep in a chair because of my back. They sent me enough gift cards to get the damn recliner. It was a very generous gesture. I didn't ask for anything. I refused to ask people for anything. But that's what they did for me because of what I do for them. So to see shit like this, it stings, but I'm a big girl and I can put my big girl panties on. How long after you can still test? Joel asked a question on YouTube. How long after you kick the virus can you still test positive? About 6 weeks. 4 to 6 weeks is about what we see the max for people having to clear the virus. In Laredo, they would not do, and I had a problem with this. This I had a problem with because you can go do this at bedside. And we know that about the time that you're starting to show symptoms, you're no longer contagious. So it's kind of like the flu with that. But your body will continue to shed the virus. And that is where the PCR test I have an issue with, because it depends on how good the swab is, what area they swabbed. Is the virus here? Is the virus there? All that lets us know is there the viral RNA. It's not, are you contagious or not? We don't know how long ago you got it or not. That's antibody. The PCR test just lets you know it's a rapid test, but they're only about 50% effective. We need the saliva test, but you know what? They want to have like a little device to go with it, like a blood glucometer to plug it into to read it. We don't need that. We have like litmus paper strips. You put it in your mouth, wait 5 minutes, and it will have a color change, and it will let you know if you have the virus in you. It's like 500 of them cost you like $5. We could have those in the hands of every American person. And we would know if we could send our children to school, if we should go to work. It would answer a lot of questions very cheaply, but they want to add that device because it's billable to insurance. It's all about money. This is why I need you to vote for people who have our best interest at heart, because right now, nobody has our best interest at heart, because the two things that could really help, the RLF 100 and those saliva tests that are both cheap as hell, it's the two things we're not dealing with. These guys have been ready to go for 6 months to get these a saliva test out to us. I will share the YouTube channel for MedCram for all the testing information, because the guy, Dr. Mina, he is awesome. Awesome video. Please, please, please watch it. He's got a lot of great information. I will share it and attach it in the description once I get done with the video. Please, guys. I mean, we need to vote for the people who have our interests at heart. I don't want to hear any political comments, please. I think we are all over politics right now. What I'm asking you to do is just make an educated vote. Don't just go blindly vote by party. Look at what they're standing for. Go to town hall meetings. Call. Madeline calls all the damn time. She asks them all sorts of questions and she puts their backs to the wall. And that's what we need to do as citizens. We need to hold them responsible. And we need to vote for the right people, because it's our fault that we're putting these career politicians in office who are getting kickbacks from Big Pharma. Get rid of them. Get the guy who represents El Paso. Nominate them, not somebody who's looking for fame, fortune. Get the little man, because that's who the majority of the U.S. population represents. Let's see here, more questions. I know you're desperate, but is that really a smart choice? Slugbug, let me know about the desperate and the smart choice. I know I've been talking so long that I probably lost track of what the comment was. Oh God, how do I get rid of that? Go away. I don't want to comment. Sorry, I've got this all screwed up. As soon as he is sworn in, you will hear about it. Make bets. I don't think we will. Unfortunately, the timing will be convenient enough for him being sworn in to make the statement, but he also wants to lock our country down. Lockdowns are not the answer, folks. We have lost almost 30% of our small businesses in El Paso. Those small businesses, they pay taxes here and they're prospering. A lot of them are Trump supporters. And that's another thing. I have been stopped by many Hispanics in the middle of driving, like accident causing, just to give me a thumbs up. Men, women, stop me in the parking lot at Walmart to give me a thumbs up on my Trump sticker. They think I might be racist, but then they realize that I treat everybody the same and I have a big heart that I'm not. And they tell me I'm prospering under this administration. I'm making more money. I'm able to support my families back in Mexico, because that's what they do. They come here, they have American businesses, they pay American taxes, but their profits go to support their families back home. And it's really important to have those businesses open here in El Paso. And it's very important. Oh, yes, hold on. I'll answer that in just a second. It's very important to support our local businesses, because they are the ones that are hurting in Michigan, all across the country. The hell with Walmart. Go find the people who need that support, because they're being very innovative and they're going above and beyond to protect themselves just to have an income. Joel asked, are symptoms common 14 days after testing positive? Honey, if you take a look at a COVID long haulers group in Facebook, these poor people are having symptoms 8 months out. They'll go through cycles. They're calling it post-viral syndrome. So yes, the answer is yes. They're losing clumps of hair. I shared that picture. Oh crap, I forgot to send that to her. Dang it. I'll share the pictures. There was a clump of hair from one of my followers' wives, and then from prolonged intubation. This is another problem. This poor woman has a benign cyst that is growing over her vocal cords from being intubated too long. And it grew back, so she's got to go back she can't even talk. So these are what I am really concerned about, the long-term effects of this. If we can get you to follow the guidelines that the governor, not the city of El Paso, I do not agree with what the city is doing. And I understand there are nurses who are making statements out in front of hospitals that the city shouldn't have reopened and blah, 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 blah. No, the city should have been enforcing the governor's guidelines since July, and we have not been doing that. And that's what screwed us up here. But closing us down because you failed to do your job is not the answer. We have other ways of doing this. You should have been going out into the community and educating people, asking them if they need anything. The El Paso Food Bank, we have Lyft drivers. I get the email every week, but I hate driving Lyft, to bring food to people who are stuck at home. If we just do certain small things, like only send one person to the grocery store, wear that mask like we're asked, limit our exposure inside of buildings for right now, we wouldn't be in this mess. But people didn't take it seriously here. And the mess that we are in is the result of all that, unfortunately. Our love that we have there are families that have huge gatherings, and I love being in the neighborhood in the summertime and hearing everybody completely happy. And I don't speak a lick of Spanish, like I said, but hearing all the Mexican music, and you can feel it. You can feel the happiness in it. It gives you a good vibe. It's a positive energy. And you know what? That's lacking right now. It's killing people with depression, and they're self-medicating with alcohol. Kids aren't going to school. They rely on the food programs because they feed kids breakfast, lunch, and dinner here. There's a lot of stuff that's happening because of these lockdowns, and it's not okay. What do you think about it? Okay, I did read, Jonathan, I did read that, and I also read her statement. It was a private gathering with her family that she was already in contact with. So we live in multi-generational homes here, as everybody knows. So grandparents, aunts, and uncles live with the family, and that's who was there. It just looked that way, and it made an appearance that she was throwing this huge party. The same thing happened to the governor up in Michigan, unfortunately. People made this assumption that she threw her daughter this huge, extravagant party after shutting down the state, and that's not what happened. If you go and read her response, it was her mother and father, and there was a few close family members there who have already been in contact with them. So yes, it did look pretty poor on Facebook, and that's probably something I would not have put out there, or maybe wrote an explanation with that, because I would have been concerned about how that appeared. So I do understand where you're coming from with that. I'm glad you did point that out. I did see that, but I did read more into it, and it was a private family thing, but we do, and I'm sure there's a lot of, I'm probably going to pronounce this wrong, forgive me ahead of time, but the quinceañeras, which is the 15-year-old parties, and they go, it's almost like a bar mitzvah, and it's a very happy event, and none of these kids got to do that this year. They've had so much taken away. There's so much beauty in this city, in this culture, that people don't understand. I love sharing it. When I hear that music, I love sitting outside the bars down on the strip and doing Uber and just listening to the music and everybody's laughter. Now, there does get to be some chaos, and the cops have to shut the entire street down because we get drunken fights, but sometimes it's soldiers. It is what it is. You have that. But overall, the happiness in this community, I didn't get to feel that this summer when I did come home. It's lacking. Let's see, when is an individual not considered contagious anymore? According to the CDC, it looks like they want you to quarantine 10 to 14 days after you no longer show a fever. That's the recommendation at this point. It's probably a wise one, because we don't know exactly at what day after you start showing symptoms that you're no longer contagious. We're still doing that research, unfortunately. Science takes so much time. It's not easy. We form the questions, we do the tests, we come out wrong, we have to start over from scratch. It's not easy. So 10 to 14 days, they want you to quarantine after symptoms, unfortunately. Definitely wear a mask. I don't believe it's going to be that long. I'm sure it's, once we find out, it's probably 3 to 7 days, but I'm sure it's also going to depend on the particular patient, their immune system. There's so much research that's going to have to be done. It's like, look how long it took to get the research on H1N1 and the original SARS virus. It did take a while, unfortunately, to have those answers. So for safety's sake, the CDC is saying 10 to 14 days after symptoms at this point in time. Oh, darn it. There we go. You have compassion for your patients and us, public. You're trying to help us know the truth, and I thank you for that and having us as a friend now. Thank you, guys. I really try to go above and beyond. I was hurt. And yeah, I got on her comments because it was wrong. She made my coworkers and my family over there. That's my family. I still talk to her. You know what I did from the front lines? I kept in contact with my former director at UNC. I was telling her everything we were finding. She was relaying it to the administrators there. We were in communication and working together as a team about what was and wasn't working. So we knew how to help the patients better. So I was on the front lines doing these videos and also talking to people back in El Paso with direct influence on care. I have not had I had to take a break. I went to Yellowstone to get a break. I took a short break for back surgery, but all of my time has been devoted to COVID education. Like I said, if you go to that MedCram website and you look at how much I have watched every one of those videos and done all the education. I have a thick notebook not COVID. It's taking away from my PTSD. I do veteran advocacy, and I am working with veterans off grid up in Taos, New Mexico. I have so much I need to do, but COVID, I'm actually going on to my master's in social work in the spring because I know how traumatized that we're all going to be. Healthcare workers we are traumatized. She's traumatized. I'm not making fun of her. She's traumatized. She signed up for something she wasn't expecting. Unfortunately, when you answer those ads, it tells you, a telemetry, COVID, intensive care, long-term care, clinics. Don't sign up for something you're not qualified for just because you're chasing money for new furniture, sweetie. But she signed up for that knowing she wasn't qualified and became traumatized. It's not funny. We have a lot of the amount of death that we have witnessed. Like I said, out in New Jersey, I lost half my patients midway through my shift. We don't have time to process how many people we've lost before the next patient comes and we have to give them all of our attention. We don't even get to process that. So I need you to think about that. It's hard. It is really, really hard. If you don't have a fever, can you have COVID? Yes. A fever only presents itself 30% of the time with COVID. Dr. Mike Hansen did a great video last night. I will share that in the description as well. It's a comparison between common cold, flu, and corona, and how to tell the difference between the symptoms. So I'm going to share that too. Thank you for that question. But no, you don't have to have a fever with COVID. A lot of people start off with a massive migraine. That was like one of the number one complaints. One of the other number one complaints that we were seeing was gastrointestinal problems, a lot of nausea, vomiting, and diarrhea. And then the headache started. And then the fever came later, not initially, but it did come, but it came after the other symptoms. So I will share that. Hang on a second here. Let me write this down before I forget. So Hansen video, and there was something by Dr. I was going to share Dr. Swelt's playlist. Sorry. So I will take care of that because I can't do it in the descriptions of this live YouTube until it's done. Great points on trauma-informed care. Yeah, and we deal with fatigue already in healthcare. I mean, we get alarm, collate burnout. We get burned out, and I do like to rotate out of the critical care unit once in a while just to talk to people. I was so happy to go to Illinois and Georgia because there was talking human beings. And for somebody to make a comment that, I can say these things because I'm white, it doesn't affect my race. It does. I worked, and here's another thing about compassion. I had a patient in Georgia who was a very respected member in the community, had a lot of ties, and he was going downhill. And I was fighting so hard. I needed a part that we did not have. And he worked with me to get a hold of representatives, to companies, to the EMS. He was helping me help himself. It broke my heart when I got home. I found out he had been transferred out to another facility, put on a ventilator, fought for like 2.5 weeks and wound up passing away. It just broke my heart. And he was white. So we're losing it, but this is the population here. It's just like with African Americans saying that in like Chicago, for example, that the police are profiling. If you live in a population that's 85% African American, statistically, what are the odds that you're going to pull over a black person? They're pretty high statistics. And I've done probability videos. They're in my playlist. Ask these guys. It's a statistic that you can't get rid of because of the population. It's the percentage of the population. I mean, I hate that. I don't want to see anybody die from this. I wish people would have just listened and followed directions and not talked about a face diaper and how we're trying to take away their freedoms and liberties. You didn't do this with seatbelts, and you didn't do this with cigarette smoking indoors. Why are we doing this over a mask? I understand it became, I honestly don't think this would have been a big of a deal if this would not have been an election year. it became a political problem. And COVID does not discriminate between Democrats and Republicans and independents and libertarians. It discriminates against Hispanics and Blacks, unfortunately. And it pisses me off because nobody deserves to die, especially being exposed inadvertently and unknowingly. I did write it down. I did. And you're here, you can remind me later. Do take out, yeah, it's like buy things that you can have delivered to you. Walmart does home delivery, Instacart, Favor, Postmates, they all do delivery. I've been ordering Uber Eats. I deliver Uber Eats. I try to stay out of places. I don't want to go in there. But we have a nation of traumatized people. PTSD is rooted in fears. And it rewires the brain and how you think, unfortunately. My ex-husband is dealing with this severely, which is how I got into advocacy and a lot of research on that. So I'm lacking on my research for my veterans who are relying on me for information with that. So I am trying, guys. I am stretched thin. I need a personal assistant to get all this stuff done. I'm on 2 cell phones and a laptop to try and get this information out here. I got Instagram, Facebook, and YouTube just to get the message out. So I do take up a lot of time. So to see this is completely disrespectful. This thing's up to 3,600 views now since I've been doing this video. People are listening. So to hear the hate, I don't want to have to shut off the comments. I opened up the comments on my original rant video, and there's like almost 3,000 of them, but people were getting really stupid. That mucus plug has become the most famous and most proud mucus plug of any respiratory therapist I know. Everybody took off with that. So please, I will once again post my Instagram. You can message me through there. I'll leave my email address because I can always block people who harass me. It's not that hard. Just block. If you're going to be a jerk, just block. I don't have to respond to you. And this one chick, this passion lady, oh my God. Oh, you finally responded to me. Honey, I responded to you 15 times until I had to block you because you were getting on my nerves and just leaving trash on this thread. So you're muted. You're not allowed to comment anymore. Sorry. Don't be like that. If you have a question, please ask. I am more than happy to answer. I am more than happy to do a live video and explain. We are scared. We are rooted in fear, and we are reacting off of fear. Fear is an emotion. Our veterans, when they are triggered, that's an emotional reaction. When they're snapping at their wives, screaming at them, and not remembering, it's an emotional reaction rooted in fear. And we have a nation of people who are reacting off of emotion, whether it be Black Lives Matter, Antifa, the conservatives, the liberals, the people in the middle, the people attacking each other. We don't need to call each other names. We don't. And this lady, oh, I've experienced racism there as a kid. Well, I have heard 0 derogatory terms. The only N-word I hear is from my neighbors calling it to each other in casual conversation. I don't see it here. I'm sorry. I just don't see it. All of my friends here are Black. I don't see it. So I don't understand why we have to attack each other. This is one of the kindest communities I have ever lived in. I couldn't wait to come home. I missed UMC. Every facility I was at, oh, we're a county hospital. You have big ideas. We can't afford that. But you know what? UMC has it. We have rotochrome beds there. We are flipping patients over by hand to bone. You know how much energy that takes and how many people it takes to do that? We got 200 ventilators running in this city. That's a long time, and we need to prone patients to improve oxygenation, and that's one thing that you can do at home. Yay, you found me! I'm hard to find because I am banned on Facebook till like December 4th under my main account. So when I add you guys as friends, please check your spam messages. One thing I forgot. Check your spam messages because I have sent you messages from the hidden profile that I have where all of my followers are at. And I share the information. I got banned on Facebook, shadow banned. Never told me what I shared that was inappropriate, anything, nothing. I mentioned COVID, so I'm banned until the 4th of December, which is a bad time to be banned, so that's why we're doing it this way. But it's under the Misty Huffman V is my normal profile where everybody's been following me. I've uploaded everything to YouTube, but check your spam message folders, because I have to message you back from that account, and it usually goes to spam. So look at your message request, and you'll see it. I'm not going to announce what it is here. My ex pain in my butt right now. We're still working on our divorce, which is delayed 19 months due to lawyers and COVID. So I don't need any news out of him because he's got some issues that he needs to resolve, unfortunately. And I'm not looking for problems when I'm out here trying to educate and not cause fear. He's reacting off of fear, and that's what I'm trying to quell everybody's emotion. I learned all this from him, unfortunately. Well, there is a silver lining in every cloud. I've found my ways to speak up for others who can't. I still got another private message yet coming in again from a UMC employee. They don't want it. We can't comment publicly most of the time. So it'll make the administration look bad. Luana already made everybody look bad. They don't want to add to that. So we're not okay here, Tamara. We're up to 200 ventilators, a lot of deaths. I start work on Monday, more than likely. It might be Tuesday. But unfortunately, it's pretty bad here. We are like a new epicenter. It's a large city with a small town feel. And that many vents running in just this city, it's a lot, unfortunately. It's not pretty, but we are El Paso strong, and we're going to get, you're damn right we are. But we need to support one another. This stuff needs to stop. You be the change that you want to see. Actions speak louder than words, and they always will. So don't get on here and you're out doing something about it. Bring us food. Help us out, man. We're starving to death. The cafeteria at UMC, and then now we're pre-packaging food. It's not the best food. And when you're starving, I mean, beggars can't be choosers, but I ate a lot of salads there. But when the Walmart shootings happened, the community was bringing food for all of us, the staff, the family in the waiting room. There is somebody there that you can talk to if you want to have something delivered, to help out, just to show your appreciation for what we're doing. We are struggling here. These are our loved ones who are winding up in the hospital, people we know, our own coworkers. So to say that we're not being aggressive, honey, you don't even know who you were taking care of. You don't know us here. And I am part of this community now. I'm sorry, I'll be here almost 4 years come summer. And I am part of this community. This is my new home, and I refuse to leave here. I love this place. I love the people, and I'm here to help you. Allow me to help you, because this is not helping. Luana is not helping. Think about it, folks. We are still deploying people to El Paso to help. Luana was here for 2 weeks. She was either fired or she quit because she couldn't take the stress. So the rest of us, I have members who were through Crucial who were in Laredo for 67 days. Most of these people work 7 days straight because that's how Crucial operates. You don't even get time off. You might get a day, then you got to work another 7 again. Let me tell you, after 4 12-hour shifts in a row of stress, you need a break. They were making them work 21 days straight for that 10 grand a week up in New York. That's how mistakes happen. That's why that girl referred to a safety issue, that it's unsafe practices. You are putting people under that amount of stress who are not trained. We are not soldiers. We're not. We are not trained to work like that. We are told we need to get rest. Night shifters have a higher risk of health problems because it messes with the circadian rhythm. I'm a night shifter, but I always have been. I don't function during the day. Doctors have been villainized, rumors of we're not making money off COVID, folks. We're not diagnosing you with COVID just to have the money. We have to have justification for that. We do lots of testing. We do the x-rays. We do labs for ferritin, LDH. I'm trying to remember. is the CRP levels. We're looking at the D-dimer. We're looking at all that because it all paints a clinical picture, even if you test negative. Because the X-ray and those blood markers let us know that that test is probably erroneous. Doctors are doing all they can. We've lost a lot of doctors. Many doctors have died. The guy that I work with on Be the Change, Anthony Russo, had a guest doctor from Georgia, Dr. Frank. He was gay and a funny guy, loves his patients, and he worked even while sick, fighting COVID, recovering. And then he wound up dying. So it has affected us. It's affected us greatly in the medical community. The nurse that was with that 19-year-old, right next door to the 19-year-old football player I was taking care of that I suctioned out the mucus plug from, he hung on at a pH of like 6.9 for 3.5 days. That's unheard of. This guy fought so hard. He was a beloved member of the staff. They were devastated. So it is affecting us. It's affecting our mental health greatly. In Laredo, there is a hotline number everywhere in the hospital for us to call if we're struggling. I shared the hotline number for the suicide prevention with the news lady, Shelby, that I had done the interview with today. Like, please, my message is, especially in this community, in this culture, suicide is not talked about. We had a kid with a gun when I first moved here over near Pebble Hills. They posted a warning and then they never followed up with what happened. And the kid had killed himself. We found out through my stepson's Snapchat. So it's not talked about here. And that's something that we need to make changes on. We do need to change that because we don't need to be afraid to talk about this because we need that support. And this whole country is traumatized. We are going to be dealing with this for a long time, which is why I'm going into social work after respiratory, because I can see the future that we're going to have a shortage of social workers and a lot of trauma people. And we still have our veterans that we have to take care of. Child abuse. Most people with PTSD have experienced some form of abuse in childhood, whether it be physical, sexual, verbal, but they've experienced some kind of abuse, so they're more prone to these problems in the future, especially if it's unresolved trauma. It's very important to understand that in this community, and I cannot stress enough how important it is to talk about it because we do need to talk about it. We cannot hold it in because it leads to more self-medicating. I have people, so many people under the age of 40 in the city dying of end-stage liver disease from alcoholism, 38 years old. But when I talk to them and I ask them, what age did you start drinking? Like 8 to 10 years old. Because it's normal to them. They're around it. It's accepted. And their life is over when ours is mostly beginning in the second half of our lives. And that's scary. That's really scary. 38 years old, turning completely yellow and foaming at the mouth because your liver's shutting down. I don't want to see people self-medicating because they're afraid to deal with the trauma. It is. We're all living in fear. It is flat out trauma, and nobody has the right to compare your trauma to theirs and tell you that you're not justified in your feelings. Don't ever let anybody invalidate your feelings because that's wrong. Trauma affects everybody differently. It can affect you 20 years from now out of the blue. So don't ever let somebody do that to you because it's not right and it's completely erroneous and not factual. She wasn't blaming the nurses, or am I wrong? It all depends on the facility's the policies, Tamara. In Laredo, the doctors do not go on any positive patients forms. They do everything by Zoom because they would have to go into every room. And think about if you have 80 COVID patients in a hospital, you're in a room 80 times. Think of the risk of exposure when you go in there and also when you come out with other people taking off your PPE and throwing it into the air. We can do just fine by Zoom. Our critical care nurses and us respiratory therapists who specialize in critical care, because that's our ventilator, we know what we're doing. We know what to relay to the doctor. We know when to call the doctor. We know what changes need to be made. They can see the patient. They'll ask to see in Michigan, when I worked for McLaren, they had like a little robot doctor with a stethoscope built right onto it. So the doctor would tell us where to place it and they could hear the patient. So they rely on us. We are a team. A lot of, like when they do rounding with the critical care patients, you have the doctor, you got the respiratory therapist, you got the pharmacist, you got the physical therapist, you got dietary, you got everybody. We're all together as a team, but not all of us need to be in that room. Respiratory has to go in there. That is my ventilator. I can't have the nurse in there running my vent. The nurse has to take care of her IVs. I can't take care of her IVs. Hell no, I don't want that job. I don't touch your machine. No. So it's a teamwork thing. It's not the doctors that they don't want to. It's that we're mitigating the risk to everybody. Because when we take off that PPE, those things fly everywhere and it's airborne. It's not just droplet. We know that it's being put into ventilation systems and spread. And that's what another thing people don't understand is that in Wuhan, it was in a restaurant. And when they mapped out where people were sitting and how it spread, it was in direct path to ventilation. So it's really important. And that's why we don't want a bunch of people in the restaurant. Sit outside. We got outdoor heaters. It's not that bad here in the winter. I mean, the desert's beautiful, honestly. I'm from Michigan. It gets negative 20. I came back here when it got snowy and cold. I'm like, hell no, I ain't doing that no more. My blood's too thin. I belong out here where it's 110. I'm good. But it is an airborne transmission. So when you take off those PPE items, you are we are trying to minimize aerosol generating procedures. They call them AGPs. So we found that high flow does not produce. We thought it would because it's all water and droplet, but the majority of it, because it's so high flow, goes right down to your lungs. So we just put a mask over the patient, and we have found that the risk is like slim to none. So we're using the crap out of high flows now. BiPAP, we're using those at first. Now we're putting filters on them because they're working, and it's keeping patients off of ventilators, and we were not doing that in the beginning. So those are changes that we have made by experience. She was blaming the doctors and nurses that we weren't being aggressive enough. There's nothing to be aggressive about. There's nothing we can do. She never gave an example in her aggressiveness other than to tell us that we weren't bagging people and we're not coding people. Only 10% of people survive. And with COVID, you have so many microemboli that we can't even oxygenate you. So bagging you, that was the point I wanted to make. When we do brain death studies, okay, let me explain something to you. When we do brain death studies, we take you right off the ventilator. And what we do is we cut veins off of a nasal cannula and we stuff it down that endotracheal tube. What it does is it washes out the lungs with oxygen. And what's amazing is you can watch the patient not breathe at all for 10 minutes. But their oxygen levels still stay at 98, 100% because it's a diffusion process. So even if we're pumping that oxygen in, if there's a diffusion problem because of the emboli or whatever's blocking the way for the oxygen to move through that membrane, we're not going to get it in you. So bagging you is going to do nothing. That's how intelligent this nurse working in critical care is. She couldn't even think about that. You're getting oxygen. If your body can't diffuse it, it can't diffuse it. There's nothing we can do. They can't even see the emboli that are forming on a CT scan. It's in autopsies that we're finding them. And that woman can't tell you that stuff because she hasn't done the research. I spend so much time researching that I have way more credit hours than I need to renew my continuing education every year. Most people I know are scrambling to get it done every year. Mine is so far over the limit because I go to conferences. I stay on top of the newest things that are going on, the newest research, the newest data, because it's important. That is why we have continuing education. And you can tell that this woman didn't do that. She can't tell you any of these things. She can sit there on camera and cry about how we're not doing anything, but she can't give an example other than bagging a patient who's already getting oxygen. We do brain death studies all the time. The heart beats, but you don't breathe. But yet we have oxygen down that tube for over 10 minutes sometimes, washing out the lungs, and it's there to diffuse, and it does. With COVID, it can't. Same people know that. When people follow the rhetoric, get embarrassed when they catch it. I have a spiritual channel. I just started a channel on narcissism. Oh, yes, I'm familiar with that. It's like I said, my ex-husband with PTSD and brain injuries is also a narcissist. Great at gaslighting. So when I deal with this crap, I just shut it down because you ain't going to bully me. You're not going to intimidate me. I know what I'm doing. I would not have had interviews with health magazines. I wouldn't have features in magazines. The news out here, they've seen my stuff. They know I'm credible. I shared my licensing credentials, and somebody's like, what, are you, a doctor? Well, apparently you didn't watch my video because I shared my credentials. So if you haven't watched the video, you have no right to comment, because once again, all you're doing is reading a headline and making assumptions about something you didn't bother watching or listening to. So that's the message I have for people. I am always out here to answer questions. I mean, you can stalk me down with questions left and right. I will always answer them. If they get to be abundant, then I usually do a live video so people, like right now, ask questions on platforms and they can answer them live, because people are scared and they need immediate answers. And I know that Dr. Fauci was doing live video questions. You got to figure most of America was probably tuned in, and probably people overseas and bombarding that. What we need is an individuals in our community that can do this for people to help understand. Do outreach at the church. The churches, we're big. We have lots of churches here. You walk into Walmart and we have candles of everything. Everything. You don't see that in Walmarts in Michigan. But here we could reach out at the churches and talk. We could do those things to educate people, and we're not doing that. And that's our community's fault. That's where we failed you. And that's why I started doing these videos, because we failed the American people in many ways by the way we handled this pandemic. Like I said, Asia, they're back to having concerts in person and everything. And you know what they do? They don't bitch and complain about wearing a mask and social distancing. That's all they're doing. That's it. And that's all we're asking you to do. But because it became a political issue, now he's divided on masks and down party lines. COVID became a politics. Everybody said, oh, COVID will just disappear after the election. Oh no, it got worse, and I knew it would. Look at all the rallies and the Biden rallies that happened. He accused Trump of being a super spreader, but then he's not denouncing the people going out and celebrating in mass quantities, not social distancing. So it's hypocrisy. We don't need that in America. We need a strong leader. We do. We need somebody who sets a positive example. I need another JFK out here. We do. Please, somebody find us somebody worthy of running this country that can unite everybody and set a positive example, because that's what we really need in America right now, because we are divided. We are full of conspiracy theories because we are being told one thing. The reason that the CDC recommendations change, guys, is because science. We discover things. So as we discover things, the recommendations change. Well, because recommendations change, conspiracy theories pop up. We're not trying to do that to you. We're trying to provide you up-to-date information, but where they're failing is they make these changes and then they don't do a press conference about why. When they made I don't even know what the hell the crazy recommendation was. I've done so many videos on the CDC, but we're like, why did you recommend this? It doesn't even make sense. Why? And they never did. They just made like a short statement and never explained anything. We need an explanation here, guys, So we're being failed by all sorts of organizations, and we have to rely on people out on the front lines to provide us accurate information. And I know plenty of other respiratory therapists who are chronicling their experiences. Not everybody likes to do research. I am a knowledge junkie. All I do is read. So I do the work that other people don't want to do. And then they come to me for answers. I gave a doctor over in Georgia, we were having a conversation, and he's like, and he was kind of testing me at first and getting kind of pissy with me, but he knew by the way I was responding that I knew my shit. And then he asked me, because out of respect, because he knew that I knew what I was talking about, Can I see those articles and those recommendations from the WHO? I've not seen them. I said, yeah, it was hard to find. And I brought that to UNC, and it was all about how to treat COVID patients, whether it be pediatric, adult. If we need mechanical ventilation, we do this. It was a step-by-step. But that document was hard to find. But he asked me for it because he respected what I had to say. Had a doctor from Florida call me last week, works in the ER, wanting to know more about what I knew about RLF 100. People, I'm contacted by the people that matter. I'm not just some a-hole out here trying to get attention from Crucial because I'm traumatized. Well, hell yeah, I'm traumatized. I do deal with trauma counselors because we have to get that off our chest. I would highly recommend her calling one of those hotline numbers that's provided to us because she's traumatized. And hopefully, it usually after the first 30 days and your brain doesn't make you replay these things over and over again in your head, you get desensitized to it. It's when it lasts long term that it becomes post-traumatic stress. So that's what we're dealing with now. If you look at the behavior of people and then you look at how our veterans react when they're triggered and what they're dealing with, it's very similar. And that's what I began to notice early on in this pandemic. Let's see here, make sure I answer everybody's questions. My old pastor from my church is not doing good, has COVID, been fighting since November 5th. Machines aren't working, prayers, all options have been exhausted. And that's what's happening. And I'm sorry, I'm very sorry. But that's what this Loana, she wants us to be more aggressive, but if I give you more PEEP, I'm going to damage your lungs, and they're already damaged. We know that high PEEP is bad. We don't have ECMO here. It's very, very limited in many states. There's only like 2 or 4 in certain hospitals. I mean, if you got 80 people needing it in one city, imagine the whole state. We just don't have that infrastructure. It's not available. So she, again, gave no good example of what she wants us to do inside there. She's got plenty of thoughts about what we're doing. We're not bagging. Do you understand why? I mean, you have to look at the risk, have to look at the benefit. And if the benefit does not outweigh the risk, you do not do it. You don't even do it in life. I'm sorry. I am. I came home because this was breaking my heart. I was hoping to God this was not going to happen in our city. I really was. I figured since we didn't get it too bad in July when Laredo broke out again, the bars reopened here, that we were going to be okay. But I don't know what happened. It seems like there had to have been one major event or something that went on because it was in a matter of a week, all hell broke loose. So if all these people are getting sick, then they were in contact with the super spreader. And I need you to cooperate with contact tracers because we need to be able to trace back where. We're not trying to violate your life. We're not trying to take your guns away. We're not trying to do anything to control you. We're trying to get the data to understand how this spreads so we can better protect everybody and not shut the economy down. The economy does not need to be shut down. I understand the nurses are upset and that they are angry that we reopened and they overturned it, but be angry at the people. Be angry at the right people. Be angry at the people who are not following directions. I got called a fucking piece of shit at the storage garage when all this broke out. When I got back and I went over to the storage unit, there are 3 people, black, white, and Hispanic. You want to talk about racism? They were all there. Going in and out of the building with no mask on. And they're moving heavy things. So you're expiring more droplets into the air. And I said something, when you go in that building, masking applies to you. You're not exempt from it. And I went in and I told the lady who was working, look, you got these people moving in and out here. We're on a mask mandate. It's important. I'm a frontline worker. They need to wear their mask. And she had to come out and talk to them. And she started screaming at me, you're a fucking piece of shit. I said, you're the fucking piece of shit who doesn't care about the people in your community. All you care about is yourself. And I put it on Instagram. I recorded her. This is the person. If she belongs to you, you need to do something with her. The 2 guys were kind of embarrassed and were like, I'm sorry, but she No wonder she was moving all of her stuff with her friends. If she's that hateful, she probably don't pay her rent either. But I'm not no fucking piece of shit. I care about people. I care too much. I give more of myself until I am flat on my ass just so somebody else can eat. So don't tell me I don't have compassion. You don't know me. But I have made a lot of good friends since that rant video went viral. And I am proud of what I do. And I am not intimidated by people bullying me. But I am going to stand up when it's right. And my coworkers at UMC did not deserve the nasty things that she had to say. And like I said, yeah, I saw that, Tamara. I couldn't believe New York City. I mean, this was like 2 months ago when I was watching live videos that somebody was doing. It might have been you. Somebody was doing live videos, I remember, Facebook from New York City, and they were doing a walk, and I'm looking at everybody in New York. But look at New York's cases. They're like this tall because it ripped through that entire community, and whoever was going to get it got it, and it's done. Don't think they're going to see any more spikes up there. In these really bad cities, I don't think we're going to see it as high as we do. After this is over here, I don't think we're going to see it spike like it did, because everybody who's been in contact, for the most part, is going to be affected by it and have some form of immunity or resistance to it. I feel like at this point in time, if I was going to get COVID, I'm going to get it. So you know what? I will volunteer as tribute, may the odds be ever in my favor, to go in before somebody else who's scared. I take the lunch trays in for the lunch lady. She's like, do you think you can take this in? Sure. Absolutely. Because I'm part of the team. It's not just me. I'm just respiratory. It's not my problem. I help those nurses bathe the patients when they don't have any CNAs available. I'm in the room with them. I'm going to help my patient. I wouldn't want that happening to me. Yes. Okay. So it was your video. I said, yeah, she was doing a beautiful video, but you look around in New York and nobody wearing a mask. Problem is, a lot of people ride trains into New York City and then like Madeline's in Pennsylvania, and then we take it back there. My ex-husband's motorcycle club is an example. They usually hold an annual turkey run every year, and they donate the turkeys in the community. They went to New Mexico over to a place bar in Oro Grande. No masks. You can see the pictures on Facebook. They're everywhere. No masks. But yet they come back to our community and spread it. He went to Sturgis. Remember Sturgis? How many people in South? I want you to go to the Johns Hopkins tracker and take a look at the COVID case of Sturgis. They went out to North Carolina for their motorcycle national event. Not a freaking person wearing a mask. So all these people who are coming into contact with one another who might be asymptomatic are bringing it back to our communities and infecting us. And those are poor choices. Don't support the motorcycle clubs that do that. They should be like, hey, we're going to do a virtual run. We're going to come up with a new way of doing things to support our community and keep them safe. But it's selfish. It's about them. And that's one of the reasons why I'm so happy to be out of that situation, because they don't care about the community. It looks like it, but they really don't. Those actions always speak louder than their words. And by looking at those pictures and seeing those things, I know damn well that some of those people probably brought back COVID to their community. It's sad. And I'm sorry it has to be a political thing, because honestly, if it wasn't a political year for an election year, we wouldn't be in this mess right now. It's all of our faults for falling into this trap, because that's what it was. We were played by the media, who instilled fear in us and made us question everything. Whereas if it wasn't an election, they would have been sharing information like I'm doing for you. You'd see Dr. Gupta and you'd see all these other doctors. They'd be interviewing people, but they're not. All you see is scary numbers. Even though and here's the thing that they're not talking about. Yeah, we have these high number of cases spiking, but you know what's not? The deaths are not spiking in relation to the cases. They were in the beginning. They're not now. But we're not talking about that. We need to be talking to the scientists doing all the research. Out of curiosity, can one lose their voice with COVID? I would imagine it's possible, People get really bad sore throats. So I would imagine like laryngitis type symptoms. Yeah, I would say so. It's another thing is usually a bad sore throat in the beginning. Let's see here. Make sure I'm getting through all these questions. Okay. I wonder if he's an SCRC. They either no RRMC. I won't go any further than that. People can Google it. But for what they supposedly stand for, their actions are not following what their mission statement and then they're supposed to be supporting in their community. And great, I understand that you want to support the community and provide turkeys to those who can't have Thanksgiving dinner or afford one. But we could have done it in a different way. We could have done it virtually. You could have done it in a socially distanced way. The My Place bar is a little hole in the wall biker type bar with no seating, no space. It's just like a little kind of like shack on the side of the road, and people are crammed in that damn thing, showing up. And then his girlfriend's a school teacher, posting on Facebook how she can't wait to go back to school and teach. You're taking that to the people who are working with you because the teachers are at the school using the resources and distancing, but you're still in the ventilation system. Wow. That's going to hurt our children or the people who live with the children that they take it home to. Those are not smart choices. That is selfish as hell. And I will call that behavior out because that is what's causing these spreads. People thinking, oh, I'm not going to get it or I'm just going to get it, whatever. But they don't think about how their actions affect other people. And universal karma, we need to treat all people like they're God's creatures. You do all things with love and good intentions. That wasn't good intentions. That was selfish. That was not thinking about the community. They could have had a drop off. They could have done a number of things and been innovative, but they chose to do that. He used to do the nightly COVID rides in the beginning of the pandemic when we were. Yeah, a lot of them are just not. Motorcycle clubs aren't what they used to be anymore. They're just really not. These guys got out of Vietnam, were looking for a place to belong, and formed brotherhoods. But the problem is they're sleeping with each other's wives. They're backstabbing each other. They're doing all these horrible, murdering each other, doing all these horrible things in the name of a brotherhood that doesn't exist. You're not going to find the same thing that you had in combat. And most of these guys don't have your back. I know some people who were in a really bad bind and their own chapter members didn't even step up to offer any kind of help, but yet that's a family. And your family's supposed to help you out in times like that. So no, I don't agree with any of this. Willful ignorance. That's exactly what it is. My sister has all of her family, kids, grandkids, great-grandkids come to visit all the time. All of them interact with a lot of people. Hard to say who they've been in contact with. I know a lot of people have done like a plastic thing with the arms so the grandparents could hug the kids just not to infect them, but irresponsibly doing this, yes, Marilyn, you are correct, is how it spreads. Kids are not as highly affected. The ones who were affected that we were seeing the multi-system organ failure in are more than likely anti-vax parents. They're not vaccinated, so their immune systems don't have any kind of defense built up. They are susceptible to everything. So yes, in those areas, Michigan and New York, that's a huge anti-vax area. We have outbreaks of measles every year because they don't vaccinate in certain areas. It's like a huge movement. But that's highly irresponsible. And kids are great spreaders of viruses, even if they're not sick, because their immune systems are young and healthy. As we age, our immune systems break down. The flu shot, if you look at the flu shot commercials, they're a different one for elderly people because they get a double dose practically. It's because their immune system is more broken down than ours is. A child is like, yeah, it's like a Marine going to combat. They're ready to go. That immune system is in overdrive and they're not symptomatic. But that doesn't mean that it's not going to go to the adults who are susceptible, and that is irresponsible. Um, I would definitely avoid them, Marilyn. And if you do, skip the surgical mask and put on an N95. The latest rhetoric I'm hearing is I stay healthy and take vitamin C, D, and C. We know that these antioxidants help. We do use them as a supplement. I'm not going to lie. Melatonin as well. Melatonin we have found is a great antioxidant. I actually follow the lady Doris Lowe. One of my followers brought her to me. This woman's a piano player, and she should have been a scientist, a rocket one. She had around 400 sources to her paper to find the CD147 cell and the link with melatonin. Her paper was peer reviewed before many other papers. There are scientists citing her work, and that's when you know it's credible. So, but it's IV melatonin, but still take it. It's not going to hurt. I will tell you that, but I would add melatonin to that mix. And you got vitamin C in there. We know vitamin C, like in our soldiers when we did the study, when they have traumatic injuries given by IV, it does help when the body is under extreme stress. And I would say when you're on a ventilator fighting COVID, it's extreme stress. So they're not going to hurt. They're great antioxidants. And I will actually also try to find the MedCram videos since we've talked about all these topics. I will go pull those MedCram videos because they're only about 15 to 20 minutes at most. Dr. Schwelt does a great job explaining. Sometimes it goes way over my head, but I have to Google it or keep it simple for me. But he does a really good explanation lately. He's really kind of dumbed it down for us to understand how things work. In the beginning, it was really hard. But he's realized that more and more people who are non-medical are watching his videos. And Dr. Mike Hansen is really good as well about educating. He's also a pulmonologist. And none of those are going to hurt, but they're definitely not going to cure COVID. I'm going to tell you that much right now. People are saying, yeah, you can't substitute it. You can help with the antioxidants because COVID causes a state of oxidative stress. It is not a respiratory infection. It's a virus that gets into the body and it affects the blood vessels. It's the endothelium. And I guarantee you this chick, Luana, can't tell you any of this. She's probably thinking, oh, it's a respiratory virus like the flu. But it causes inflammation in the blood vessels all throughout the body. And even those tiny, like with the COVID toes and fingers, those capillaries are tiny. And if you get emboli in there, you're definitely going to have some discolorated fingers because it's not moving and it's plugged up and it's really thin. But it inflames that and it causes a state of oxidative stress. Now, those antioxidants help to stop that from happening. But at what levels, we don't know. But we do know that there's some help with vitamin D and vitamin C. But the thing is, folks, we give that by IV doses in the hospital. You could not take enough vitamin C or vitamin D pills to give you what we're giving you at the hospital. And please don't try it. You're going to puke. Take it daily as a possible prophylaxis to help boost your immune system, but don't count on it as a supplement to what you need. Yes, you want it to be strong as possible. Always do things, exercise, keep that heart healthy, keep your immune system healthy. All of those things are extremely important. All right, scrolling back up. Oh my gosh. Okay, here we go. My church is giving families gift cards. That's a great idea. And if you get gift cards, send one person shopping. We are in multi-generational homes here. There's plenty of people to babysit. We don't all need to go. I know it sucks. Go to a park. Outdoors is universal ventilation. If you are outdoors, which she's like, when I was at the storage unit, you're not wearing a mask. I am 50 feet away from you outside. You don't need a mask for that. If you can socially distance and stay away from people, then don't wear the damn thing. But when you're getting in close contact and we know that droplets will spread farther than 6 feet. It's more like 12. So Don't let people invade your personal space. Elbow bumps. We do lots of elbow bumps in the hospital now instead of high fives and handshakes, you know. We just have to change our behavior patterns. We don't need to lock our city down to get people to behave. It's like, we can't do it anymore. It's been 8 months of this crap. We're done. People are sick of it. And that's why this is happening. We're revolting. I forgot to mention the numbers started to rise at the local high schools, and the kids are now on an alternating day schedule until the 30th. They are in class 2 days a week for the next 2 weeks, unless the numbers go down here. They might even go back online. A lot of places have gone back online because, like, the colleges are having major outbreaks. My college students, guys, you're part of the solution. This whole millennial attitude thing and the whatever generation they call them now. No, you did it wrong. Listen to your parents, please, for once. Gladwin has 374 cases and 5 deaths. It's hitting us hard, and Gladwin High School is closed till November. Damn it. See, my son's in school up in Coleman. Our numbers were 9 kids, 14 staff in almost all of the high schools locally. That's what prompted their alternating school days. And I don't even know if alternating school days is the right answer. It's not going to stop the people who are infected from coming to school. It will alternate how many people are in the school. But I know when I went to pick up my son, there really wasn't a lot of parents in the parking lot like normal, because half are online and half are in school. And that helps to spread things out. My son needs to be in school. He's ADHD, ODD, and conduct disorder. So he does not do good on a computer because he cannot sit there. He needs to be interacting and learning by doing. So for those kids, those are the ones that need to be in school. If we can have the other ones at home, great. Here in El Paso, it's hard because families work. People work so many jobs here. This community is so hardworking. So this girl saying she can't even find a job is BS, because we got plenty of job opportunities here. She just must have a lot of demands and conditions, Annabelle, that nobody's going to resort to, because I never had a problem finding a job here. Not at all. Let's see here. In North Carolina, they've removed the signs requiring masks in the stores, and they've removed the 6-foot markings for people in line. Well, good thing I'm working on my North Carolina license. I have to go get fingerprinted, but COVID, it's really hard to do because they want handprints like in person. They don't want the live scan ones when you're out of state. And I have my Michigan and my Washington and my North Carolina license. So I am licensing in more than just Washington and Texas. I've got North Carolina I'm working on. I've got a temp in Illinois, New Jersey. I'm licensed in many states, folks. I shared it. There's no disciplinary action on my license. People just want to attack somebody because they're trying to spread truth and facts, and they apparently like emotional reactions. And she can go follow her. But when she's not doing anything for her, she knows where to come back to. I'll be right here waiting for you, sweetie. Our school went total virtual at the end of the month. I've seen a lot of news posts today about people going to all online. They've can't, like a lot of colleges are like, nope, we're done. Because you got to figure, in the college dorms, we get a lot of outbreaks of meningitis. And I don't even know if I want to call it meningitis with these COVID patients, because it's an inflammation caused by the virus of the brain. So I would call it more like an encephalopathy, but it causes confusion. None of my patients have woke up like even making a damn bit of sense, except for the one guy who in very dirty Spanish apparently asked to have relations with his wife. Unfortunately, he didn't get to do that because he went back on the ventilator 3 days later. His behavior became out of control. The encephalopathy was causing a lot of problems, and they had to put him back on the vent, and he passed away within a few days. Everything shut down. So we are being aggressive. We've been putting Impella devices in people to help with heart problems. Things that we do, folks. I know you think, especially a lady who doesn't work in critical care, she should know better. She really should. She should know that there's other things out there as to reasons why we can't or aren't doing certain things. You know, I bet you she doesn't know that plasma, in any kind of plasma, not just convalescent plasma, if you go and get blood, we run the risk of you clotting. There's a problem. It's a common problem with plasma. But she wants us to give it to everybody? Do you see where that would be harmful? Remdesivir causes kidney injury. We can't even give it to patients who have kidneys, any kind of kidney problems. And then when you're on it and you start having kidney failure, we got to take you off of it. And then we know it doesn't work. So, sweetie, somebody's got to answer this question. You know, ask her this question. What is it that you want us to do? Because she can't answer it. There is nothing we can do. Unfortunately, it's a waiting out thing. Like I said, people are on vents for like 20 days before I can even consider, because they buck that. The brain, your respiratory center is right here in your brainstem. So all the chemoreceptors that control what your body is doing is right there. So when your brain gets inflamed, it inflames all of this, and it's a crazy respiratory breathing patterns. We don't want to have to paralyze the patient because a paralytic can cause problems long term. So it's on an as-needed basis. Sometimes we give them boluses. It all depends. And if you don't work critical care, sweetie, you don't know. You don't. That's all I've done. The ER, and you know, when you're working in ER in Flint, Michigan, and you're getting shootings and people being dumped out of cars in the damn ER parking lot, and you're like carrying people in, you know, and your trauma pager's going off that it's, you know, on foot. You're like, wait, what? They were dumped off. And you're like, holy crap here, man. So there's a lot of things that happen in healthcare that people think they understand, but they don't when they don't work in it. Even as a new person, it took me a good 2 years before I was really comfortable making critical decisions like that. It's a skill that you have to develop. It's not something that comes textbook. You need practice. And if you're working in a nursing home, you don't have ICU practice. That Erin Olszewski went up there. She couldn't even run an IV drip. She was a school nurse. Same thing happened to us. Are you snoring? Yeah, they're both snoring. But she wound up there doing that expose on Elmhurst Hospital, and if you go to Zdogg MD's website, he has letters from people who worked with Erin Olszewski. And I'll share that too in this description. That way it just kind of gives you guys some things to read through. And you can read the actual statements about the actual situations that happened that she was on camera undercover talking about with them. That's a HIPAA violation, number one, because she was showing in that video, like, the patient identifying stuff, taking video in the hospital. You're allowed to video in the hospital without permission. So she really violated a lot, and they're suing her ass for that. So to the Christina there who wants to argue with me, I know my shit. I suggest you get up to speed before you start spreading false information, and I have to go behind you and clean up your mess too. But I think I've got, let's see here, I scroll into home. I see that the Red Cross is testing for antibodies in all blood donors. How long? We don't know. We know that at least 3 months. The thing is, you spike up real high with the antibodies and then they slowly decline to almost an undetectable level, but that doesn't mean you have a T cell immunity. There's like memory cells. So do those cells remember and then create more antibodies if you're exposed again? We don't know. So at least 3 months, we can tell you that. I think there's only been 2 cases of reinfection, and one was so close together that I don't think it was a reinfection. I think it was a post-viral syndrome type thing. He still tested positive, could have been with a different strain, so it's not happened a lot. The other guy was like 143 days apart, and the strains were totally different. Viruses mutate. It's going to keep mutating. It's going to keep figuring out ways to spread easier until it rips its way through the entire population, or we get vaccinated, or we do whatever. But we don't know on the antibodies that long term. We know at least 3 months. Hopefully in a few more months, we can say, hey, we know for at least 6 months. So we're taking it month by month doing that research, and we're testing that. I'm glad the Red Cross is doing that. It's really important because that could divert asymptomatic people who have developed antibodies. It could offer us more monoclonals, which is really important. That's the antibody that actually works in some way. But the regular antibodies don't work for the critical patients. It does not improve the PF ratio. Like I said, the only thing that does that is the RLF 100. And it's all the stuff that the media is not talking about. So I challenge you to start pressing your representatives, your senators, anybody you can. Worf, would you stop snoring? Hey, he's a Maine Coon and he's 25 pounds. He's quite disruptive sometimes. He's a big kitty. But I think I've answered everybody's questions. We have cases so far in school. Oh, let's see here. Okay, if anybody does not have any more questions, I'm going to wrap it up because what time is it? 9:20. The 10 o'clock news is coming on and I want to catch the interview because it's the first time I've been on the news. So I will share that in a separate YouTube. I'll download it or whatever, or link to it. But I will go put all the links to the description in my YouTube video. Facebook is a pain in the butt to do that. You guys all know my channel. Just go to the YouTube video. But please share. Get this information out there. If you know people who have questions and need answers, send them here. I will give them factual information so they can make an educated and informed decision for themselves. You're not going to get the crying, sobbing nightmare from me. People don't need to see that. That just causes more anxiety, and we have enough of that as it is. We don't need that. So send them my way. Share the video. The reason my video went viral was because of my Michiganders. You guys shared it in like nursing groups because there was a lot of nurses scared at the time, and it went nuts. They were sharing it everywhere. I'm not trying to instill fear. Facts over fear. If you guys want a great network for good news and good healthy conversation without being tore apart, go check out Be the Change. You can find it on Facebook. He's out of Dallas. It's Anthony and Cash Kelly. He's a Black conservative. He used to be Democrat, became a Trump supporter, huge advocate. Cash is always on the show, but they support being the change that you want to see. Cash does the Streetlights Unity movement, and what they do is it's a network for people to go when they really need help. Like if somebody wants to donate a sofa, okay, and you need a sofa, that's all that platform is used for in the Facebook groups is support to do things like that. There's no memes or anything like that. How does Cash say it? Unite, don't fight, be a street light. What the hell's the last part, guys? I always forget it. Unite, don't fight, be a street light. And I know it's always be the change that you want to see, but Cash always says something at the end. I will remember this eventually. But it's a positive environment. It encourages healthy dialogue from people of all backgrounds because they want to hear your side. They want people's voices to be heard. It's like the new media. This is what we're having to do so we don't have to worry about CNN and Fox and CBS and putting all this political commentary into something. We just want information. So if you want good information, go check them out. I'm going to wrap it up. I think everybody's good. Facts over fear. Always, 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 guys. That's what I am. You can see I am facts. Luana is fear. I don't think she's a bad person. I think what she did, she handled wrong, just like Nicole Serotek's video about us murdering everybody out in New York City. There was a lot of healthcare providers that were really hurt and upset and angered over that. And that is when my video went crazy. So people don't want to see that. People who play into that drama, that's who winds up not following directions and doing the right thing instead of going to find somebody who's trying to give the information out there. You can tell in my words, I don't put up with crap. I'm from Detroit. I'm born and raised up there. I got a hard-ass attitude. I am a tough girl, but I also have a very, very kind heart, and I will do anything for anybody. I send my LLC that I created by going to the front lines to get the capital to start my business. My profits go back to help my veterans and their families. The VA doesn't cover like therapy for the whole family and they can't afford it with their copays, they come to me. One of my veterans, I paid for a hotel room for 10 days out in Philadelphia because he had to go to a specialist and the VA was giving him the runaround and he needed to get that MRI done. I paid for that. So that's what I do. I give back to the community. I give back to the veterans and their families. That's what I'm out here doing. So to tell me I don't have a kind heart, you piss me off and you are going to get my tongue. I try not to rant too much because nobody wants to listen to a screaming woman. Luana's going to lose a lot of her followers here in 2 or 3 weeks. It's just, she's going to fall off unless she changes her attitude and sets a better example. Now, that doesn't mean that some people aren't doing their jobs. I mean, it happens in every industry. I try to make people responsible and accountable for their actions when I see that happen, or I report it to my supervisor. That's all I can do. I can't harass somebody at work because I don't need to get in trouble with human resources. But I am here to help. If I can't get you the information, I will go find somebody who can. And I will go out of my way to do that. So you know where to find me, and I will share everything in the description. So you guys have a great night. I love you all. Thank you. I don't even know what that video is up to now. I just kind of been, what did I do with it? I think I put it up in a new window. Ah, shucks. I was just kind of curious to see how high this is going because I've not had a video on YouTube this successful. YouTube is really hard to get viewers on. It makes it really hard. Like I said, everything I've done has pretty much been on Facebook. So to see a YouTube video like this is actually, I'm really amazed. 4,036 folks. The news must have came on to 7 o'clock because we were at 3,500, a half hour, 45 minutes ago. So share, please. People are needing the information. They're watching, and they're watching for a long time. I mean, when I'm looking at watch time in hours, it's 317.6 above normal. Like the views are 3.6K more than usual. So this video is getting attention. People are listening. They want the information. So forget the trolls in the comments. A lot of that crap I just hide because y'all don't need to see this. I don't want negativity. I want positivity. I want my community to heal. I love it here, and I want to see people survive this. We have lost at Providence in Trans Mountain. We lost a nurse early on. It's been traumatizing for everybody, and it's time to start healing. We need to heal as a community, and we need to get along. If you could change career to be a doctor or stay as respiratory, I don't want to be a doctor. It's just like all the other doctors who are regretting just not becoming a PA or an NP. I'm going to become a psychologist. The master's program, since I already have my bachelor's degree, is only 16 months for social work. Once I get my master's in social work, I can actually start to bill Medicare and insurance companies. And then after that, it's only like 2 years for my doctorate in psychology. So I'm going to technically be a doctor eventually. But I was always trying to figure out how I was going to tie my veteran causes and my PTSD advocacy into what I do with respiratory. And I've figured it out now. I'm going to build on that and become a social worker and be a very well-rounded one, because a lot of our veterans with PTSD and having problems have sleep issues. That's me. So it'll actually help me help them better. I already have 258 completed credit hours. I could be a doctor, but I have a degree in heating and cooling. I did a year of computer accounting and absolutely hated numbers and sitting at a desk. And then I have 2 degrees in respiratory, my associates and bachelor's. So I'm a very well-educated individual, and I guarantee you this woman is not, because she did not even have the common sense to think about the oxygen being able to wash out in the lungs, and the body is still able to get it if the ventilator is giving it to you. Bagging doesn't matter. Those chest compressions aren't really going to do much at that point in time. You only move like 15% of your body's blood anyway, and if you are already restricted because your blood vessels are swollen and there's clots everywhere, that blood is not going to circulate. I mean, I don't know what she wants. Please answer me. I don't know what aggressive maneuvers she wants us to take. Lung transplants, brain, I don't know. I know we're doing all we can, and I'm watching all of my nurses and coworkers devastated because everything we know medically to do in medical science to this point is not working. So she needs to answer that question because I guarantee you she can't. All right, guys, I'm going to end all the streams here. All right, you have a good night. I'll put everything in the links here in about the next 10, 15 minutes. Thank you.